Hello, everyone, and welcome to the very first edition of Faces of Denial, brought to you by the Global PAD Association. In the labyrinth of American healthcare, perhaps nothing is more devastating than when a patient in dire need of care, life and limb saving care, is denied a potential life and limb saving procedure, not by medical consensus, but by an insurance company's review process. Today, we're going to speak with a patient who faces this exact nightmare with Wellcare Insurance in Louisiana. This is not merely a story about medical bureaucracy. It's about life, limb, and the devastating human cost when financial calculations override medical expertise. Our patient guest today has already survived what most would consider impossible, multiple failed bypasses, a catastrophic infection that nearly cost him not only his leg, but his life. Months upon months of grueling hospital stays and rehabilitation because of it. Now, when one of the world's leading vascular specialists has determined that minimally invasive procedures are this patient's only viable option, an insurance company doctor who has never examined this patient in person has denied the treatment based solely on scans and paperwork, insisting instead on a high-risk axillary bifemoral bypass. This procedure carries significant mortality risks, particularly for medically complex patients such as Thomas, and is often considered a last resort or palliative measure by contemporary medical standards. Now, what makes this case particularly troubling is that this patient was previously told by a cardiothoracic surgeon who saved his leg that he should never undergo additional open procedures due to his high-risk status. Yet here we are with an insurance company effectively sentencing him to either a potentially fatal surgery or the progressive suffering of untreated vascular disease. The impact of insurance denials on PAD patients, such as Thomas, is well documented. I'm not sharing anything new, but what's disconcerting is nothing is being done about it. Yet studies show that insurance status dramatically affects not just treatment options, such as those with Thomas, as he is on the state or government system, but also their outcomes with underinsured patients like him facing higher rates of amputations and complications. Today, we're going to put a face to these statistics. I'd like to welcome Thomas. Thomas, thank you so much for your courage, and I'm so sorry about your continued suffering.
Thank you, and hello, Kim.
So, can you just take us back to when you first discovered you had peripheral artery disease and how your journey led you to the Global PAD Association?
Okay, I was back at work. I walked into work as normal one morning, and it stopped me dead in my track. I almost fell over with it. The pain was so bad. But I thought I had a pulled muscle, or just something minimal. But as the day went on and on, it gradually got worse. I went to ER. They told me I had neuropathy. And I told them, no, I have peripheral neuropathy, but it doesn't affect me like this. They sent me home with Lyrica. Well, this went on for a week to where my boss and director, he sent me home from work because he walked behind me and he seen the situation it was creating for me, and walking in pain and everything else. So I eventually went to see my primary care physician. He sent me to a cardiovascular surgeon, one who had never been to before, which took 4 months for me to get an appointment in, no matter how bad it was. Well, when I finally went to see him, he admitted me into hospital because I had no pulses in the left foot or the right foot. But the left leg was the worst leg. They they run some scans, and then they tried to do a cath lab with me through my ankle on the left and one on the right. They told me that there was no way they could get in with the cath. It had to be open surgery. That if I didn't have it, I was going to lose definitely one leg, if not both. So, well, they kept me in. They arranged for the surgery, and when the paperwork came up to sign for the surgery, it said they were doing the left leg. So I questioned it, and they said, "No, that's the correct leg." I said, "No, the left leg is a problem leg." I said the right only gets a little pain when the left gets bad. So anyway, they never changed it. They told me they were going to do a femoral graft, which I don't have no knowledge of or anything else. I'm not medical. So they prepped me. I went down to surgery. 9.5 hours later, I come out. They could hardly get me out the anesthesia. My kidneys hemorrhaged, both of them. They never caught it until the last minute when I was complaining. I was getting really weak. They read the scan wrong. They said, nope, it shows everything's good. Then a nurse come through 10, 15 minutes later saying, I found it. And they put me on to blood thinners to clear the blockage in my kidneys from the blood buildup. I spent a day in ICU when the surgeon come round and told me, oh, it was a success, it was a success. You don't need to have your left leg done no more. You got a pulse. But when he went down to find a pulse, there was no pulse. And then all of a sudden, out of the blue, there was this really strong pulse. 3 days being in that hospital was enough for me. They did so much wrong to me, which I'm lucky I'm still living. And when they pulled the cath out from my bladder, it wasn't all inflated, in deflated, and they ripped me inside out. And after that, they let me out of hospital a week early because of what had happened to like kind of fend for myself, stay on the medication, follow up appointments. When I followed up with my cardiologist, the original one who sent me for the surgery, he had retired. He had since retired and wouldn't see me. They didn't know why I was there to see him. So I was back to stage one again. After 2 weeks, I had to go to another hospital to get scanned because of all the pain and everything going on. They told me it had failed. I was completely blocked, and there's no other hospital that's really prepared to go over someone else's surgery that was done wrong. The only thing they suggested to me was I see their cardiovascular surgeon at that hospital, which is saying he seemed very knowledgeable in everything else, and I believe he actually did, what he said he was going to do, but it failed, and that's where I ended up with gangrene. Now, going back a bit, how I found Global Pad Association was I was going through a lot. I didn't know what to do. I didn't know what to say, who to contact. I was afraid. I was in fear of everything. And that's when I come across the peripheral artery disease group. I never mentioned anything. I think it was until about 3 days later, everything that had happened, everything that had gone on. And I remember speaking to you. You spoke to me in a message saying, Thomas, can you cancel that procedure. Let's get you to go see someone else. The insurance had already gone through. They wouldn't allow me to. I could have cancelled it, but my insurance wouldn't have paid for any more procedures or surgeries. So I went through it, and I believe it was about 2 weeks out of hospital. I come down with the start of a bad infection. I went to hospital with COVID, and they told me they couldn't treat the wound. They said it looked good. It was blood. It was clean. Didn't even clean it up. But they wanted me to go back for not a COVID vaccine. I can't remember the name of it. It was something they put through an IV in my arm. And I asked them about the infection. They said, no, we can't treat it because you have COVID. I said, well, I'm here with COVID. Why? And they wouldn't treat it. This went on for, I believe, 6 weeks until it got too bad. It was stinking. It was rancid. It was nasty. And they kept telling me I didn't have infection in it. That was when you sent me to, I believe, Dr. Ali for the wound care. And he said he would follow up with me the next week, you know, stay on the medication I was on. When I went back the next week, he admitted me into hospital with gangrene and the fear that I may lose my leg through amputation. As it went on, the surgery was successful. The surgeon had done, and he told me I wasn't going to be amputated, but I needed to stay in hospital for quite a long period of time. It was actually 6 weeks. And I went from one hospital to another hospital because they couldn't care for me at the first hospital with the extent of what was going on. The next hospital, they got rid of the gangrene. And sorry, I had a phone call. They got rid of the gangrene, and they were ready to do another debridement just to make sure everything was all clean and ready to go for skin graft. They got it cleaned out. The man who does the skin grafts come up and spoke to me, the surgeon, and told me, yes, I can have the skin graft, and it would be done within the next week. He did the skin graft. It was successful. The wound was clean. It was covered, and you couldn't see all the holes and all the big wounds or anything in it. So they decided to let me go home after 3 days, which then I followed up with Dr. Ali in Lafayette. For the next, I believe it was a year, I went through multiple debridements. So whenever I went back to work, it would open. They would debride it and regraft it. This went on about, I don't know, I think 5, 6 times. And when it come to like it had healed and I went back to see the surgeon, he told me that I was blocked in areas that he couldn't get through. And I couldn't have no open surgeries whatsoever. And I remember the exact words from him on an interview he did with Global Pad Association was, I have no landing pad to do it. Only procedures would be allowed. Because he couldn't get through that, I come to you, as a last ditch effort, keeping my leg, and you sent me to Dr. Walker. I've seen Dr. Walker. He explained to me, the risks involved, what stage I'm at, and he also told us when both of us were on the phone conversation at my appointment that I couldn't have no open surgeries because of the extent of my health, the dangers of it, and it would be too much for me. You know, they would. He said the exact words were from his nephew was, "I may get through it, but I wouldn't last like past a few days or whatever through it. The risk was far too high, and they would do procedures." When he explained the procedures to me, that all made sense to me, you know. And they did tell me there was no guarantee that they may be able to get through it at all. So I had the first procedure. He got through it. After a few hours, I could go home. And he was the first surgeon to get through all those blockages that everyone else said they couldn't get through. And the only option was amputation. So as time went on, I blocked up again. I believe it was in different places, more places. And where I was unblocked was blocking again also. I went back. It was 6.5 hours in the surgical room. Dr. Walker went through. He removed all my blood clots. He removed a lot of the blockages within the time frame, you know, that he had 6.5 hours. It got me back on my feet again. And the next day, I got out of hospital. I come home. I felt a little sore from it, you know, because the way they had to go through and everything else, and the areas they went through, from the blood clot machine that they used to take the blood clots out. But it wore off after like I think it was like maybe 3 or 4 days, and I was kind of coming back to normal again, feeling myself and everything. I started doing my walking, and it was going great, and I thought everything was good. You know, I didn't have hardly any pain until one day I walked in my backyard. I walked up through the yard. It stopped me dead on my feet. Almost fell over. I had to grab onto my shed door. The pain, I'd never gone through so much pain in all my life. It was in my groins, in my lower stomach, both legs down to my toes. And that's when I went back to see Dr. Walker with a follow-up appointment. And he explained to me then that I had blood clots, I had blockages, and he really wasn't sure if he could get through it. And he left it at that, and he went out to make a call. He come back in and he sat down, and he looked at me straight in the eye and he said, "Thomas, I can't just leave you to leave my office like this." He said, "I have to try and get through it, you know, to at least try. And if we can't get through it, we we'll go from there. You know, what's next?" And this was a procedure that my insurance didn't outright denied. They didn't give me no reason why they denied it. Um, just
So what's
absolute
interesting to me is that you said that the cardiothoracic surgeon told you you do not have an appropriate solid
right,
landing zone anywhere in your legs for that would create a durable bypass situation. And that's why these minimally invasive procedures, while there is a revolving door of them, and maybe you're just kicking the can forward to just delay what may be inevitable, which is amputation.
right,
But the question to you that I think that we need to convey to the insurance companies is you have told me that you would prefer to walk to live another day and live to walk another day. by even knowing that amputation could be in your future. You just
Yeah.
want to be able to kick the can forward, which is what you've been able to do with these minimally invasive procedures. Now, it has been quite a bit of time though since your last procedure, so we're moving things forward. Because of those failed bypasses before, it is my understanding that's why you continue to be hypercoagulable and have these additional clots despite the anticoagulant medication. Is that right?
Yes. It's I really don't know what to say. All I know is I told the insurance people, it was a high up person that told me, you know, they denied it because they don't want the procedures done. They're not working, and basically turned around and said in a matter of words, they're not going to work. And like, you need major surgery. And I told her, I said, no, I'm not having no major surgery. You know, I said, I went through bypasses. She said, and she kind of cut me off. She said, but what you've been having? I said, no, ma'am. If you go back and look through my health records and medical records, you will see the bypasses. You'll see the failed bypasses that never worked, the gangrene, the insurance paid for, and everything else. And it's also in doctors' notes, in surgeons' notes, that I cannot have any more open surgeries. You know, and here she is, she's telling me, well, you need to have major surgery. I said no. And I said to her, I said, if it's the surgery that I'm thinking of, which goes from up in your chest all the way down, I said, no, that's for palatable care. I'm not having it. And she said, look, you have to make an appointment with Dr. Walker again so he can explain to you medically what needs to be done. That we have told him needs to be done, as I'm not a
What
doctor.
they have told you. I want to they have told you and what they're telling your supervising physician that knows your situation best, what the insurance company and some vascular surgeon they've paid that they have hired to work on their behalf to save them money
Yeah,
is telling your supervising physician as a medical armchair quarterback what needs to be done in your case.
yeah,
And that's what's really scary. I mean, here you are, Thomas. You've survived what most would consider impossible, multiple failed bypasses because you don't have any durable landing zones in your legs, is what we've been told. And multiple severe infections that nearly cost you not only your leg and your life. I want you to describe this whole experience, what this is like for you, both physically and emotionally. What is the toll that this is taking on you?
all right. Physically, I have some good parts of the day, and I have some really, really, really bad parts of the day, thinking I'm not going to get through this, you know. But I will never give in to amputation, although I know it's on the table. But I keep pushing it as far away from me as I can, you know, and do what I need to do to try and keep my blood flow going, even through the pain from it, you know. And it's not just my legs now. I've got pain in my groins where the bypass grafts are and where my stents are on both sides. Um, the pain gradually become worse, not so much just in my feet or my calves, but it's moved up to my lower stomach, below my belly button, both sides. And the right leg has started getting like it too. It's back in my hip again, my buttocks. And but I just keep going, Kim. You know, my only option is if I don't keep going, you sit down, you stay down. You know, and I'm not going to stay sat down on this. You know, I have to move regardless of how many steps I can take. You know, how many times a day I have to get up and take a few steps and then back and forward out the yard, take my dog, you know, everything like that. Um, that's the physical side of it, you know. And also with the physical side comes like lack of sleep. I sleep like maybe 3 hours at a time. different times throughout the day, and that plays on me a lot too. On
And this
the
is where some would probably say, well, this is why maybe it's time for amputation.
right, but I won't have it that way, Kim. I know, and I can understand why. Honestly, I really do 100%, and my heart goes out to those people who say, "That's it. I've had enough. I can't do this no more." Um, but for me, it's different. I thrive on fighting this. You know, the strength I got from my mom when she died when I was 3 years old, but the strength she didn't have the strength to carry through her cancer and everything else. So I gained her strength, and I won't give in to it. You know, when I tell surgeons and doctors, they smile when I say, look, when my leg is hanging off, my foot is hanging off, and it's black and everything else, you can take it. Until then, it's not been touched. You know, and they see the humor out, you know, and because they know I know that the day is inevitable. Sometime I don't know when that they're going to amputate above the knee. With the right leg, I don't have a clue, Kim, because it's blocked right up too. The only difference is I don't have so much pain in the right leg as I do in the left. Um, on the emotional side, I don't know, Kim. I don't even know how to explain it. You know, I never before suffered depression, which I get. You know, just out the blue for days and days and days, and I fight it. I don't want to go into no more medications or anything else. You know, so I fight it and I get through it. And I'll maybe have like 3 or 4 good days where like everything seems normal. I forget about all this PAD, but it's a constant reminder to me from the pain of it. You know, you can't just shut it out and like put it to one side. You have to deal with it. You know, um, other emotional facts. I really don't know what my family is going through. They really don't say a lot, you know, but not saying a lot is not a it's not a bad thing, you know. I think maybe they're thinking, how do we deal with this? You know, we don't know how to deal with this. I really don't know how to deal with it, you know, apart from what I've got to do is, you know, get up, walk around. I get the dizzy spells too from it. Really lightheaded. Just standing making a coffee on it is so painful, you know. Times I've come close to falling, but I've managed to catch on to something on the way down, and it's just a struggle. It's a struggle every day, Kim.
And here you have, I'm curious about the communication between, Wellcare and you. What has this process been like? Have you been able to speak directly with the vascular surgeon who works for this insurance company, who is armchair quarterbacking your own doctor, who denied your procedure and is saying, hey, you need an open procedure. I don't care what even your cardiothoracic surgeon says, that there's no landing zone. I think this is your only and your best option. So take it or leave it. So either take it or and have a high risk of dying, or leave it and lose your leg and then ultimately increase your chance of dying with a high mortality rate in the 12 months to a year, 12 months to 18 months following any major amputation for a situation with someone with PAD and CAD. So no matter what, it seems like their options are sentencing you to death in the next year or so.
Right, and that's exactly what I've said to people. When I called up Dr. Walker's office today, I spoke to his secretary, who is partly dealing with my appeal on this and everything else, you know, and I told her, I said, either way, they're giving me a death sentence. You know, I said they don't want me to have the procedures, which keeps me going for months. Maybe this one will last 6 months, maybe a year, I don't know. you know, and she agreed with me. I said, like, I can't have any more open surgeries. And I told her the situation. I said, I don't know if they told you on the phone or not. I said, they told me they didn't deny surgery. They denied the procedures. And as far as speaking to the surgeon, if he is a surgeon who denied me first, I have no access to speaking to him. It's a closed circuit. It's like you just can't get to speak to him.
No,
So,
and this is just weeks and weeks and weeks and weeks of
right,
just sitting home, suffering, waiting, and waiting for the denial is basically what you've been doing.
right. And when I eventually called them because I was getting annoyed, my procedure was coming up on the Tuesday or Wednesday, I believe it was. I can't remember which day exactly. But I called them and they told me on the Monday it was denied. So the lady at the front desk of the insurance which said, Thomas, she said, look, I'm not in their department, but I can tell you what they put on paper, why they denied it. They said they denied the procedures because it's not medically beneficial. That was all they put on it. She never told me anything else. I emailed them. I got really annoyed with them, and I emailed them. It was a polite email, explaining, my fears of not having it done and everything else. And they got back to me within about 15 minutes from another company that's joined in with my health insurance, saying it wasn't denied, said, but they failed to put it on the paper. And then when the paperwork went to the next person, the last person to sign off on it, they never put the reason for it. So, so I understand why I understand it was denied and have no idea as to why. Even Dr. Walker, I told them, and they weren't understanding it. It's like they went round in a big circle, but cut across the circle, and they left the patient out of it. You know, um, I told them it's not about them. It's not about the money that you need to spend. It's about life. You know, what price is a life? What price is losing a limb? There's no price on it. And just this morning, the lady called me. One of the places I'll tell you called me was Centennial, which is an office linked to Louisiana Healthcare Connections. Then um, the other lady, she called me from Wellness, which I had to look up and make sure they're all connected. Seemingly, a lot of insurance companies merged together, which has now become Wellness, and the other one I can't remember the name of. But she had told me they were faxing Dr. Walker. They denied the appeal that I have to have this surgery or basically nothing else. She didn't say that in that context, but what she referred to was if I don't have this surgery, I can't have nothing else. You know, I expressed my fears and concerns and everything else over it. And she kind of struck me as she's not a rude person, but she come across like it did sound rude when she cut me off when I told her about the bypasses, everything else that happened leading up to this. And I also asked her, have you read all my medical notes leading up to this from a heart disease, heart failure, stents about every well, the surgeries, I said, no, the surgeries that I have is not just procedures and not just this surgeon, Dr. Walker. I said, he was my last and only option, you know, to try and get through the blockages, which he did. I said, now you're denying him from doing any further procedures because you want me to have major surgery. And she told me, she said, no, the severity of the blockages is far too much that you need whatever surgery, this open surgery, and make an appointment with Dr. Walker. He'll explain to you what's next. Well, Dr. Walker, he he's really in no place to where he can do the procedure. So the next thing is, I don't want to have this open surgery, which is my only option, you know. So it puts Dr. Walker in a bad situation, because he can't do it. And I feel bad. Honestly, right from my heart, I feel bad for Dr. Walker because he's done nothing but get through blockages, fight with it, you know, scans. He sent me for everything right there and then without even getting approved from insurance to prove, to show the blockages and everything. And I just feel bad all round. I really do. You know, I do everything that Dr. Walker asked me. I take my Medicaid, and they can see that, but my body still produces hundreds of blood clots. You know, I, I don't know what else to do. I really don't.
But at the very least, with these minimally invasive procedures that he has been doing, it's continuing to kick the can forward. So you've been
Right.
able to continue to live your life. You've been able to survive. Yes, you've been in pain, but that is your choice to continue in the direction you're
Yeah.
going and saying, hey, you know what? I would rather have a little bit more blood flow, keep me on 2 feet, and just keep kicking the can forward because I'm walking, I'm pushing through, I'm trying each and every day to just live my life.
Yeah.
And if it ends up at some point where you do need the amputation, it is ultimately what it will be. But why literally, do that prematurely and
Right.
put your life on the line with a major open procedure, which precedence has shown in your case it just doesn't work. And it has never worked because there is no durable landing zone anywhere. The only option that has been successful for you thus far has been just to take wires and balloons in there, open little by little, and just keep you on your feet a little
Right.
bit longer each time.
Yeah. Yeah. And that's, I mean, I'm happy with that. I mean, when I went back to follow up, it wasn't with Dr. Walker. It was with one of his other offices in Lafayette. And I seen his surgeon there. And he told me, he said, Thomas, he said, you're still blocked. It's a main artery from the groin all the way down. I said, oh, I said, but I feel better from like the procedure. He said, well, you got some blood flow now, you know. I said, and I was happy with it. And like I remember on my way home when we both you were on call with me with Dr. Walker, the first appointment, and you spoke to me about it and you said you understand, you know, the procedures and you may have to go back in a month or in 2 or 3 months to get unblocked again. And I'm fine with that. I have no problem with that. You know, I would rather go back every 2 or 3 months to get unblocked, or other places, something else done that keeps me on my feet, you know, with their surgery. I fear it. I have reasons, to fear it. Apart from what you've mentioned, I didn't do well in both bypasses coming out the anesthesia. Um, my blood pressure, my everything was sky high. Everything on them was up and down. And I worry about it. You know, people say, don't be afraid of dying. I'm not afraid of dying. I'm afraid of having a surgery that I'm not going to wake up from. You know, that's my biggest fear. And it's
So
not the pain, it's not the pain side of it or anything like that. I go through it, I deal with it, it's harsh. But I just don't want this surgery.
So, how does it feel to know that a doctor who has never met you in person is overriding the recommendation of specialists who have
Um,
treated you directly?
in a way, I laugh at it sarcastically because I turn around and I told the lady who called me from Centennial or Wellcare, how can he turn around and tell me what I need? You know, I've never met the man. I've never spoke to him. All you can see is my scans and information from Dr. Walker. I say, he don't know the whole picture. You know, he's never examined me or anything else. How can he turn around and tell me this is what I need? Would he be willing to do this if it was me telling him off the street, you need to go for brain surgery? You know, it's it's annoying to say the least. And I'll be honest, if I knew a way I could start a lawsuit against this and for other people, I would be doing it because they're leaving me with my hands tied. If I don't have this surgery, I'm going to end up amputated. And then the risks after that and go on and on and on. Just let me have my procedure, you know. What's wrong with trying procedure one more time or whatever, you know, just to keep me on my feet, save me from dying or, you know. That's my biggest fear of this. And it's just I don't know how these people can sleep at night saying, well, you know what, you have to have this, we're denying that, or we're denying a more expensive surgery to have this, you know, and they really don't care. All they're worried about is their big bonuses at the end of the year.
Thank you so much, Thomas, for your courage in being here today. We really appreciate you. We're going to continue to fight alongside you and hoping that we can get the help that you need to just try one more time.
Yeah,
And your doctors have not given you false hope. They have been very straight with you. And all you're asking is for that one last chance to walk to live another
yeah,
day and live to walk another day.
100%. You know, they've all been open with me, Kim, and Dr. Walker, he tells me each time, you know, when he's arranging for a procedure, he said, Thomas, you know what stage you're at with this, you know. So it's not like I don't know what's going to happen in future, you know. But the way it is at the minute, if I don't have this procedure, because I won't have their stupid surgery, I there's going to be no options left apart from amputate. They're just not going to allow it. They told me they're not going to allow any more procedures. So,
And this is an insurance company, and this is again a vascular specialist who is working for the insurance company, is paid by the insurance company to look out for the insurance company and where their
yeah,
dollars are being spent. And this vascular specialist has not examined the patient. He's looking at a piece of paper and a few scans and not considering the entire picture. And something needs to be done to change the way this system works and put the power back in the hands of the supervising physicians who know these patients best. And if an insurance company is not happy with the decisions a particular physician is making, I highly urge these insurance companies to end their contracts with those specific physicians. If you don't trust the decisions they are making, then end those contracts with those physicians and let the patients know up front that these physicians are not in network. That if you want that physician to do these procedures, you need to join with another network. The only problem is people who are underinsured or under government insurance are beholden to whatever the state or whatever the federal government is offering. And they don't have a choice, such as in Thomas's situation. And I am urging all lawmakers to take this into consideration and not let patients such as Thomas suffer. If you, as the federal government or the state government, don't agree with the decisions that physicians who you are contracted with are making in those contracts. But stop the needless suffering of patients like Thomas. If you are a patient that is on deck for amputation, please call the Global PAD Association's Leg Saver hotline at 833 PAD LEGS. That's 833 PAD LEGS, or go to padhelp.org. We're not opposed to amputation. Amputation can be treatment. It is treatment in so many cases. It's treatment because, for the most part, we have a failed system that is not getting these patients diagnosed, these high-risk patients diagnosed sooner rather than later. If we could do this, amputation would be a moot point for the most part, because we could get these patients on the conservative therapy they need sooner rather than later. But we end up with situations like this, where a patient is brushed off as having neuropathy or arthritis or fibromyalgia or diabetes or diabetic neuropathy or back issues or sciatica as being the reason for the pain, the claudication that they're suffering from. And so these patients are left to suffer longer and longer and longer before they're finally diagnosed with PAD. More than 70% of 400 patients who were polled in the Global PAD Association's network said they were misdiagnosed when they presented to their primary care physician the first time with textbook symptoms of PAD, the leg pain, the leg cramps, the discoloration in one leg versus the other, the difference in temperature in one leg or another. We got to get these patients diagnosed sooner rather than later. That is the ultimate solution. You want to save money? Don't save money on these latter end patients, the patients in advanced stage, by simply sentencing them to amputation and ultimately death to get them completely off your books. No, your savings, the best bet for you as insurance companies, is to support the early diagnosis of PAD and frontline conservative therapy. Partner with the Global PAD Association, and we'll help you get these patients diagnosed sooner, and also onto our conservative therapy program. We have a smoking cessation program. We have a structured walking program. We have a diet program, all at no cost to patients, that is successful in helping to treat these patients sooner rather than later. But please, from the bottom of my heart, do what you can to help these patients walk to live another day.